Despite warnings against the use of rapid antibody tests to diagnose persons with the coronavirus from the Ministry of Health, several private hospitals have been persistently collecting monies from individuals to conduct these tests. These tests look for the presence of antibodies, which are proteins made in response to infections. Antibodies are detected in the blood of people who are tested after infection. However, the rapid antibody test has not been approved to detect active coronavirus cases. To date, the polymerase chain reaction test is the only approved testing method by the World Health Organization. Speaking with Nightly News in a recent interview on the subject of testing for the coronavirus was Chief Medical Officer Dr. Narain Singh, who pointed out that the ministry has issued circulars to the private medical institutions warning them against offering the antibody test. Nevertheless, there have been several reports from persons indicating that the results from the antibody test would be the opposite of what the results from the PCR test would indicate. In most cases, the antibody test would present a negative result. Just recently, a report was carried in the media of a young woman who died of COVID-19 because she waited too late to access medical treatment after a rapid test that was done at a private institution stated that she was negative. A subsequent PCR test revealed a positive result, but by then, the woman was critically ill and eventually succumbed. The Chief Medical Officer is issuing a pellucid reminder that the antibody test is not diagnostic.
Because the sensitivity and accuracy it's not as compared to PCR. Most of the rapid tests can be used as a screening test. You can screen someone, but even then it's not very, because the sensitivity and the specificity for these tests are kind of low. And so it's only to the rapid test, you can't diagnose a patient either positive or negative based on a rapid test.
Dr. Singh noted that the PCR test is only offered at the National Reference Laboratory and the Eureka Medical Laboratory.
Those are the only two facilities in Ghana that can do the test. So people going to private facilities and getting tests done told that they're negative, but it's not accurate.
He added that the ministry will again issue a notice to all medical institutions advising on the approved testing requirements for COVID-19. Meanwhile, the ministry recently acquired a new piece of equipment which now aids in reducing the processing time for the PCR test result by a minimum of 2 hours. Previously, samples took approximately 9 hours to be processed at the laboratory. Temika Rodney reporting for the HGB Nightly News.